Well, free drug supplies from the government. Kind of sounds like a setup of sorts, but it's real in Hamilton County.
And new at 5, the Addiction Coalition says it is saving lives in an addiction epidemic made worse by a pandemic. Here is WCPO 9 News reporter Larry Seward.
In Hamilton County, it's a roller coaster. Overdose deaths, up to 18 one day, single digits the next, and it's those drops that worry some most.
If I see them go into single digits, I'm concerned. When you see single digit numbers, you know something's probably going on with the drug supply.
Police say coronavirus is causing illegal drug supplies, much of it mixed with fentanyl, to surge then vanish in cycles. In between, users lose tolerance, become vulnerable to overdose, and with treatment centers grappling with safety measures and ways to counsel clients face to face, the health department opened a text line. They're mailing Narcan and sending directions to tents loaded with injection supplies.
Things like transmission of HIV, hepatitis C. We know that those things are probably still continuing, and we want to reduce that as much as possible so that we don't have to deal with coronavirus and an influx of HIV or hepatitis C.
Giving users tools to get high is hardly new. Caracol started last year, but coordinators say it's never been more important.
The road to recovery is long. And it may not be well defined for every person, but beginning by using sterile equipment for many is the first and therefore most important step.
It's hardly the most controversial. Cities like Philadelphia want safe injection sites where people use illegal drugs in front of counselors. This July, New England Journal of Medicine study says an unnamed U.S. site ran 5 years without a single overdose. While the Justice Department is in Philly's way, more than 80 leaders across the country wrote letters of support, including Hamilton County Addiction Coalition founder Tom Sinan.
Watching an entire family die from addiction, I'm open to any suggestion and exploring it and at least having that discussion to see if it's feasible or not.
Is that something that Hamilton County would consider or do?
I think we're more focused on continuing with what we know works and expanding it.
Their tents in 8 communities see more than 160 people a week exchanging syringes for hope of recovery. Larry Seward, WCPO 9 News.